A new poll has found that just 21% of Americans support the Republican health care bill. 56% of Americans oppose it. The growing outrage over health care reform should be a wake-up call for Republicans. But with their billionaire base still clamoring for a tax cut, do they even care? Let's ask tonight's politics panel. And with me for the panel tonight are Horace Cooper, attorney and senior fellow at the National Center for Public Policy Research, and Doug Christian, political commentator. Thank you guys for being here.
Thank you.
Let's get started. Now, at a town hall in Willingboro, New Jersey last night, Republican Congressman Tom MacArthur was confronted by dozens of angry constituents furious about the role he played in putting together the Republican health care bill. At one point, a man got up and told Congressman MacArthur that he was, quote, the single greatest threat to his family in the entire world.
My children both have pre-existing conditions from birth. One cardiac, one thyroid. You have been the single greatest threat to my family in the entire world. You are the reason I stay up at night. You are the reason that I can't sleep. What happens if I lose my job?
So, Horace, given that this guy's family has pre-existing conditions, under the Republican health care bill, particularly the amendment put forward by Mr. MacArthur that advanced the bill, states will be able to opt out of regulations on covering people with pre-existing conditions. So my question is, how is this guy wrong when he is explaining his case
of
to
scare
the
tactics like these? Every state practically in America uses risk pools for people who have automobile insurance but have engaged in some pre-existing conditions that make them a high risk. And every single state sets up a process so that a portion of what we all pay kicks into that so that those people can have access.
You're talking about automobile insurance?
Yes. Which is mandatory.
What does that have to do here? We're talking about people getting sick and having access to health insurance here.
The plan sets up the option.
Okay,
if a state,
the Republican plan does have high-risk pools, funding for that. Not nearly enough funding for those high-risk pools, mind you.
If a state sets up the option of separate rating for people with pre-existing conditions, then they are going to have a subsidized rate. What we're doing presently is we're jacking up everybody's insurance because we are treating everyone exactly the same, and that means this guy's more likely to lose his job.
Go ahead.
Horace, I believe that that to conflate the health insurance with automobile insurance is actually a fallacy. And the reason is because most people will agree that automobile accidents happen because of somebody's at fault, presumably. However, people get sick even when they are otherwise healthy.
That is true, and a whole bunch of people get sick and are ill because of choices they make.
Right.
But not just because of choices they make. That's what I'm trying to say.
I agree.
You're not going to make that argument because that's not an argument that you want to die on here, considering that, no pun intended here, that there are illnesses of all kinds that nobody is responsible for that just happen to people, right?
That is not the driver. That is not the driver of our insurance.
What is cancer? What is cancer?
No, it's not.
Well, Alzheimer's.
The lion's share are food indulgence-related illnesses, heart disease, and other kinds of lifestyle. Absolutely, that's the chief driver, and in fact, the #1 killer in America. That's just a fact.
No, it isn't.
That's just a fact.
No, it isn't
and the second point, is this is insurance. That's the way the insurance model works.
No,
if you're going to have this other thing called government guaranteed treatment, that is not.
Which is how the rest of the developed world works right now.
Which is why the rest of the developed world
has better healthcare outcomes in the U.S. and spends less money.
That doesn't have the size homes that we do. That doesn't have the lifestyles that we do.
What are you talking about, the size homes? The size homes that 1% of the population has?
This is just
We've got foreclosure graveyards all around this country from 2008.
You go to Europe and you see the typical middle-class family, which has the healthcare
that you want. They have comfortable homes. They can afford vacations.
And they have the type of living that they envy the American people for.
But insurance, at its heart, is spreading out the risk pool. That's what
exactly
it truly
right. That's exactly right.
I mean, I come from the state, Massachusetts.
But
You may have heard of Romney Care, which is essentially what Obamacare is. And the one reason why Obamacare has really had some issues, and there have been, no doubt about it, is because the mandate isn't strong enough. No, seriously, because what you have to have is you have to have everybody in the insurance pool. That's what it all comes down to. Money doesn't grow on trees. It grows because you've got everybody, healthy, unhealthy, all together.
The product is unattractive, and all you're saying is it's not the dog food, it's the packaging and the marketing.
No.
If we had a better mandate, people would participate.
No.
It's the product that is not attractive.
It is the
people
system. It is the health insurance system that is a crime, that is immoral, that we have companies that their whole profit model is based on denying people health care. That is how our healthcare system works. It is we're the only country in the developed world that allows companies to profit off not providing people health care. And Horace, let's game out your example here. Assume that a lot of sicknesses are because people drank too much or ate too much high fructose corn syrup or something. I dispute that, but let's say that 50% of the population who gets sick is because of their own choices. Are you okay with still living in a society that condemns these people to death when we're the richest nation in the world?
Okay, see, that's an envy conversation, and I will never.
It's not an envy conversation. It's a moral conversation.
It absolutely is.
It's a moral conversation.
You're prepared to take a gun to someone's head and force them to pay for the care of another person because, quote, they can afford it.
We have taxes. We have taxes on all sorts of things. You can characterize it as violence if you want, but that's not the way anybody else does.
Let me just make this point. The Journal of American Medical Association just issued a report comparing our mortality rates and health treatment rates with other countries, and they determined that it turns out geography is a far greater contributor to whether or not you're going to have good treatment, good health care, and a good lifestyle in the United States.
What does that have to do with the merits?
First off, it's wealth. It's not geography. It's wealth.
It turns out that
when someone lives on a mountain versus the plain, it's just someone's rich versus someone's poor.
No, it turns out in certain parts of the country there is a culture that operates in a healthier way than in other parts of the country.
But it has nothing to do with socioeconomics, is your argument here. It has just to do where people were born. Maybe the people who are born next to oil extraction plants, yes, they have worse health care than other people.
Study said is that you can't actually look at these European countries and see mortality rates and compare them because there's such variability inside the United States.
Okay, so you've got...
Truly. I mean, what you really have here is you have a resistance, I see, to any kind of government program. That's what you're really coming down to.
I do have a resistance to government programs. Okay. That's true, but that's not the point here.
But it is the point because that's what the resistance is.
This particular approach isn't like the Medicare Plus program.
Why not?
It is exactly not like that. That Medicare Plus program is built on two things: the opportunity of choice and the ability of people to use their own funds to buy access to additional coverage.
Horace, you've come into this debate with your own numbers once again, so let's just move on to a different topic here. After its website was briefly shut down this weekend, the FCC claimed that it was the victim of a distributed denial of service, or DDoS attack. Pro-net neutrality groups, however, aren't buying it. While it is true that the FCC's website was down for a bit Saturday, the more likely explanation is that it was unable to handle the surge in traffic that came after John Oliver told his fans to go to agency's comment page and protest its plan to gut net neutrality. Same thing happened back in 2014. Look, I don't want to focus too much on whether the FCC is lying here, what's going on. We've got some senators who've sent questions to the FCC to prove that they were this attack and that they aren't just shutting down the public comment portal on this issue. But clearly there is large support for the net neutrality regulations that are in place, that were put in place in 2015, that Ajit Pai, the FCC chairman, is now trying to repeal. The Internet and Television Association did a poll this week. This is an industry association. These are the groups who don't want net neutrality. They did a poll and found that about 61% of their respondents either strongly or somewhat support net neutrality rules. Only 18% oppose net neutrality. Horace, why is Donald Trump, the Republicans' FCC, trying to do something that is so wildly unpopular with the American people and break the Internet?
Okay, first of all, they're not breaking the internet. What they are ensuring is that those individuals that have invested in the technology have the opportunity to tap into and exploit those resources the way that they are entitled to do.
Because the important thing about the internet is making sure that the companies can tap the resources and make those profits, not so that people have access to the greatest educational tool that's ever been created.
If you want us to have North Korean internet, have at it. That's been the plan of the left for a long time.
Because we had North Korean internet right before.
Exactly. We do not, I mean, truly, I mean, net neutrality, if you are a Republican, then you need to be for capitalism. If you're for capitalism, you're for competition. If all of a sudden, when you have a cable company, which by its nature is a monopoly, you have to protect from monopolistic impulses that actually will benefit that monopoly. What net neutrality does, and the only thing it does, is it protects the consumer.
No, it doesn't.
What's wrong with the internet right now, Horace? What's wrong with the internet right now? What's your problem with the internet right now?
My problem is that we are telling those who would be investing in new technology today, it's not going to be a good return.
And so they're making tons of profits, the internet service providers.
No, they're absolutely not. Oh, ISP providers may be. ISP providers may be, but a whole host of new dynamic technologies are sitting on the side.
Those are the people who are going to be harmed, though, Horace.
That's not true.
The content creators, the websites that are offering new services, these are the people who will be harmed when the internet is carved up and the internet service providers only offer access to the content they own.
And in fact, net neutrality is this new concept. It's only been around for a few years. Before that, we did not have the government mandating this, and we were able to get.
Everything was great, and it's working great now with the regulations.
And also, there were problems because there were many reports that there were ISPs that favored some websites and some access over others.
Right, we saw it starting to happen, hence why the rules were needed. Horace Cooper, Doug Christian, lively debate. Thank you guys so much.